My name is Bree Herring.
My name is Kim Borneman. I'm Sandy Lewis. I'm a certified nurse midwife.
My name is Carlia Norby, and I am a certified nurse midwife for UnityPoint Clinic.
Midwife is someone who is trained in the areas of nursing and midwifery. So I was a nurse in high-risk OB for about 2 years, and I went on to midwifery school.
Well, I could talk about my job all day, so I've already used way more than my one sentence. But in one sentence, we take care of women throughout the lifespan, take care of them at their yearly well woman checks for infections, problem visits, and deliver their babies.
Midwives are not people that are just taught on the fly by some sort of apprenticeship or whatnot, that they've gone to extensive schooling.
A midwife is not that's a good question. It's not an obstetrician, so we do not do surgeries.
To a 5-year-old, I would say I help mommies get babies out of their bellies, which is on a good day exactly what I do, and on a difficult day sometimes quite a bit more than that.
To a 5-year-old, I would say I take care of your mommy.
I have a 6-year-old, and I tell them oftentimes that I help mommies become mommies, help them bring their babies into the world.
One thing that a lot of people, most people do know about me is I actually married my high school sweetheart. We went to high school together, and we have 3 children together.
I really enjoy, probably to the dismay of my children, healthy cooking and experimenting with baking recipes. So unfortunately now when I bake cookies, the first question my kids ask me is if they have beans in them, because I try to put canned beans in everything I make.
I'm a very boring person.
There's so many stories in which I was able to spend a lot of time with people and really get to know them and help them out. So one story that was actually just happened real recently is I was able to be with a family after a loss, and so she was going to have a stillbirth, and I was able to spend many hours with her, and that's also thanks to my colleagues who took care of my patients in the office, so that I could just sit in her room and help her through the grief process, and even go to the funeral afterwards. And I guess I felt really proud because I know that there's a really difficult situation for her, and my presence and counseling that I did really made her feel like she was cared for during the whole process.
I am very proud to be a midwife when I get to see the looks on the faces of the mom after she delivers, and seeing how strong that she is and how she just did something that was so amazing. That makes me so proud that I can be part of that story.
It's really exciting to be a midwife when you can see women discover things about themselves, how strong they are, how amazing they are, and oftentimes, you know, they'll try and tell you things like, I couldn't have done it without you, but really we're there to support them and to be with them. And so it's really a proud moment to be able to say that you can be them with women, to help them through these experiences, and to get them through some of the toughest and most emotional days of their lives.
More than just one individual story, what really makes me proud to be a midwife is the feedback that we get from patients when they come back and say, I was so nervous, I was so scared, but you guys really helped me have an awesome experience. You know, it doesn't always go the way that we think it will or the way the patient wants it to, but that when they come back to us and just really reiterate that they felt empowered and educated at every step of the way, and that we made this process a lot less scary than the internet had made them think it would be, that just over and over again reaffirms my decision to become a midwife.